County Executive Adam Bello says the Finger Lakes region has a problem with COVID-19 and says the numbers are too high. With the holidays coming up, children will be back on break, and Bello says he has concerns about the spread during that time. He and Dr. Michael Mendoza held a press briefing today. Kayla Green was on that call and joins us live now from the county office building with the details. Kayla, what are the leaders saying?
Christian, Adam Bello says that 70% of spread in our community is coming from household gatherings, and he says that we need to work together in the holiday weeks to come to stop spreading the virus. Now, he also says that this translates to schools. He says while we aren't seeing spread in schools, that doesn't mean that students and staff aren't getting sick. Some districts in our area have already gone remote for the holidays due to positive cases in departments like transportation. Kathleen Groutman is the president of the Monroe County Superintendent's Council. She says this could be an ongoing issue if numbers spike over the holidays.
The decisions to go remote haven't been rooted in like unsafe practices in schools or spread in schools. It really is directly connected to different parts of our workforce that are impacted because of needing to quarantine or because of being positive.
Monroe County Executive Adam Bello echoed this today, saying students and school staff aren't immune to community spread when school isn't in session.
Being in school is very safe, but that doesn't mean children and teachers, administrators aren't getting sick. It just means that they aren't spreading it amongst those school buildings.
Dr. Michael Mendoza says while we're not seeing spread in schools, if the community rate goes up, statistics suggest the rate of transmission would go up in schools also. As teachers and school staff prepare to get the vaccine in Tier 2, Dr. Mendoza says we have to keep in mind the large population who can't receive it so soon.
These vaccines have been approved only for age 16 and above. So the vast majority of our K through 12 students will not be eligible yet to have this vaccine. So vaccinating the adults is a great first step, but obviously if we can't vaccinate the children, then the children need to rely on us as adults to do our part to help to keep them safe until the day comes.
Dr. Mendoza also says he encourages anyone with questions about the vaccine to reach out to his office. He says we need to reach 75% vaccination in our community to reach herd immunity, and he wants to help everyone feel comfortable with getting the vaccine. Live in Rochester, Kayla Green, News 8.
Thank you, Kayla. Dr. Mendoza also says he anticipates Tier 2 to begin by the end of January. He added that it's early to say when the general public will be able to receive it, but he expects by April or May.